You show some scary numbers on the cost of healthcare. Can you give those headline figures and the actual impact if we do nothing?
Well, currently, our healthcare system in the UK, for example, costs about £160 billion a year, which represents about 10% of the entire GDP of the British economy. It also represents about 40% of government spending. And as we get an older population with more chronic diseases and more things to prescribe, just to keep the healthcare system going on as it is at the moment, there's an inbuilt inflation of about 4 to 5% because of that older population with more diseases. So if we don't do anything, we just keep the health system as it is with a few more doctors and a bit more money, in the course of about 10 to 15 years, it will double the cost of our healthcare system, which will probably likely bankrupt the country. So we're on a bit of a burning platform. So to do nothing but keep the system going is a choice to incur that kind of cost. So we need to do something. And that was the beginning of my presentation, really, on the health system.
Is this where innovation comes in for early intervention?
Yes, if you look at the costs, most of that accrue from these chronic diseases, which generate so much in terms of poor health and costly services. But up to 70% of the NHS's costs could be saved because these chronic diseases aren't necessarily something that people are condemned to get. So, how do we change behaviors? How do we create an environment where people can live healthier? Has to be part of the answer to this challenge of healthcare of the 21st century.
When it comes to R&D investment, what areas should it go into? Because actually, it's not a cost. It's investing in the future, isn't it?
Yes, you're right. If you look more broadly, health and biology itself is the area of greatest investment in venture capital money, investment money. There's a huge explosion in the capabilities, the breakthroughs that are coming through. So it's not necessarily R&D investment of the health system itself. Already there are technology and biotech and life sciences and med tech companies doing that investment. The challenge for health systems is how does it take advantage of this new capability to be able to improve the quality of how health is done today. But I think the real interesting challenge and opportunity here is how do we detect disease before it becomes established? Because if we can get better at that, then we can save a huge amount of cost in the future of avoidable long-term conditions and avoidable complications.